Welcome to Bold Agendas, a series of thought leadership podcasts dedicated to the discussion of transformation management. In each podcast, we dive into topics of strategic interest to business leaders driving transformative change in their organizations. Today, we're exploring one of the most critical topics in leadership and culture: building trust through authentic leadership and delivering on organizational promises. For leaders in complex organizations, creating a culture of trust is not just an aspiration, it's an essential capability for navigating change and sustaining performance in the modern era. To explore this powerful idea, I'm honored to welcome Susie Jamerson, Chief People Officer for Corporate Services at AdventHealth, one of the nation's largest faith-based health systems with a deep commitment to aligning culture with strategy. Susie has been instrumental in fostering an organizational environment that builds trust, empowers teams, and prioritizes the well-being of both employees and patients. I'm Mimi Brooks, and this is Bold Agendas, leading with culture from promises to trust. Let's get started. Hi, Susie. Welcome. Thank you so much for being here with me today. It's great to see you.
Thank you, Mimi. It is wonderful to be with you. So happy to spend more time together.
I love it. I feel like I should tell people, because serendipity of meetings is always an important idea, is that Susie and I met when I was going through my coaching certification. And I was assigned to Susie, who graciously volunteered to work with, the very early coaches that we were at the time.
And you are a natural.
You're being kind. So Susie and I met then and have kept in touch. So it's really a wonderful opportunity for me to have her here with us. So thank you for coming. And I can't wait to have you share your story. I know it will be of serious interest to our business leaders who are running bold agendas. So, Susie, let me start with giving you a chance to introduce AdventHealth to the audience here, because I'm not sure everybody understands exactly the size and scope, footprint of the organization. It's really quite formidable and quite a success story under your current CEO, which we'll get into in just a moment. So how about if you give us some idea of, where the company operates, the size of the organization, workforce, et cetera?
Happy to, yes. So I have the great privilege of working for AdventHealth. We are the largest non-for-profit Protestant healthcare company in the nation, and we just recently hit 100,000 employees. We're super proud about that. I joined the organization 21 years ago, and when I joined, we had 35,000 employees. So that gives you an idea of how much growth we've had. Especially over the last 10, I would say, we have been ramping up significantly. And we are a healthcare system. So we have hospitals. We have 54 hospital campuses that are in 9 states. I work at the headquarters, which is in the Orlando, Florida area. And we started in 1973 and are just focused on whole person care and have a beautiful story. So it's an awesome company to be a part of.
It's really such an impressive organization. I didn't know much about it until I met you and had an opportunity to take a step back and learn about them, the size, the scope, the reach, the growth in the last 10 years under your current CEO, Terry Shaw, is really pretty incredible. So I think that as you talk us through the HR story here in terms of how people strategy operates inside the business, that it would be helpful for people to see that the background is this tremendous growth of the organization, particularly in the last dozen years or so. And so HR's job in, managing that and keeping up with it and keeping people engaged has really been, quite a challenge, Susie. I'm sure you've seen a lot of that agenda unfolding in your tenure.
Yes, absolutely. With growth comes complexity. And if you don't have a vision and a plan, then nothing works. And so that's one of the most amazing things about our CEOs, that he set a vision for us in 2020 that we've been working towards. We call our Vision 2030. And we have had very specific strategies and goals that we have been working towards so that we can really truly become that preeminent faith-based consumer-focused clinical care company. And we are becoming that. And we are focused on whole person care. And HR gets to be a part of that vision and that strategy, which is so amazing because we are partners with our CEO and our CFOs across the organization to really ensure that we accomplish those goals. And it's been a beautiful partnership and definitely more challenging the larger we get. And of course, in the past several years, the complexities of the pandemic did not make that any easier, but we continue to push forward and we've been making amazing progress.
So, Susie, let's decompose that a little bit because, when I look at the 2030 vision, which Terry put in place, as you said, in 2020, right? So 2030 vision, 10-year vision, and the framework of that, along with the key initiatives that you were executing on, as well as which I'm going to refer to as the 4 standards, maybe we can roll it up to, that are part of the framework, and then, the team member promises. So if I look at each one of those, starting with the 2030 vision, can we talk about what that articulates, Susie, and how it provides a North Star to what's been HR's agenda, in the same period of time?
Absolutely. I'd be happy to touch on that. Before I do, though, I want to back up a couple steps and just mention something that I forgot to mention earlier, and that's our unique mission. So our mission is to extend the healing ministry of Christ. And everything we do and any vision that, our CEO would put together has always kept that at the forefront. That is our North Star. That is where we are focused. But our 2030 vision puts together strategic aspirations so that we know how we are fulfilling that mission and how we are keeping our culture alive and how we are becoming that preeminent healthcare organization. Think of the 2030 vision as a pyramid with strategic aspirations, building from the legacy of our whole person care, and then working from that. I love this part. HR is a part of that foundational work that our vision is built off of. So becoming a dynamic learning organization and then having team member promises, that is all where the pyramid begins. That is the foundation of our pyramid. And from there it grows. And we have other strategic aspirations that will help us become that preeminent faith-based, consumer-focused clinical care company.
And we can talk a bit more, too, as we get into some of HR's initiatives. But the idea of whole person care is something that is part of, your mission in the community and marketplace that you serve. But it's also an internal idea, too, right, Susie, in terms of how you think about people, inside the organization. Perhaps one of the, reasons why, some of the healthiest workplace awards that you've won sounds like it might be this concept of, total employee care that's similar to total patient care. Am I connecting the dots correctly on that?
Absolutely. So whole person care means that we see a person as a whole person, their body, their mind, and their spirit. And so you can't disconnect those 3 from each other. They are one. And so when we talk about whole person care, we're talking about caring for the team members' body, mind, and spirit, just as we care for our consumers' body, mind, and spirit. And so it's this holistic way of caring for someone, whether they're internally a team member or externally our consumer. And the strategic aspirations we have in place all work towards that goal. But so do our service standards, which I know you referenced earlier, which is how we have agreed to treat one another as team members within this organization. And so we created that as a part of our cultural framework here. We've got our mission, we've got our values, and we have our service standards. And those service standards are really integrated into the culture of AdventHealth, not just internally, but also as we interact with the communities as well.
So, Susie, can you just put a little bit more meat on the bone for our listeners on this? So, what are the service standards that are part of the pyramid, of your framework?
Absolutely. So there's 4 of them. It's love me, keep me safe, own it, and make it easy. And those are the 4 service standards that we have agreed to as an organization. All 100,000 team members go through an experience as a part of their onboarding called the whole care experience. And the whole care experience teaches not only about our history, how we started in 1973, how we were very much focused on whole person care from the very start. But it also talks about how we agree to treat one another and how we want to show up for each other. And so we have all of our team members go through this experience where we teach them what those 4 mean, and we really bring them to life and explain, what does love me look like when you're a team member working in the office? What does that mean? Because the word love is is a powerful word that people don't always feel comfortable even using in the workplace. So we talk about, what does that look like in action? And what does own it mean? What does make it easy mean? How can we make it easy for each other, but also for our consumers that are coming into our hospitals, coming into our EDs, into our urgent cares? How do we do that? And we weave that into the entire team member life cycle so that we continue to keep those service standards alive, not just when you enter our doors and become our team member, but also as you continue to experience a fulfilling career. How do you see others, bring them to life with you, but then how do you get to bring them to life with others you interact with, whether you're an IT professional or a nurse at the bedside?
So, Susie, you think that these service standards are well understood and instantiated deeply in the organization. In other words, everybody would know them, they could recite them, they understand the application of them. That would be, a common connection across the organization in terms of, internal brand identity, if you will.
Absolutely. And I'll tell you why. I'm going to reach over and grab
Go ahead.
So this is the badge that I wear, and every team member in the organization gets this heart reel to hang their badge from. But they don't get a heart reel until they go through the whole care experience, when they can really learn about that program and understand what it means to care for one another and care for our patients. And so at the end, you get to fill in the blank here. It says, I care for you like and you put whoever's name you want. For me, it's my children, because if I want to care for my colleagues so deeply and see them as a full person and make decisions that will help them be happier human beings, then I want to care for them the same way I would care for my children. So that's where the connection comes in. And so if you walk around any of our facilities, you will see our team members wearing this heart reel on their badge. And this means they know those 4 service standards. They understand what that means. And we also do something really cool where we have our mission and peer review at our different facilities every few years. And that's where we go assess if the workforce feels connected to our culture and our mission, and if they really see it come to life day to day. And it's an audit we do internally of ourselves to ensure that we are maintaining and keeping our mission at the forefront, and that our team members feel connected to our mission. And as a part of that, we ask team members randomly. They don't know if they'll even get called upon, but we go to the different campuses and say, do you see the service standards lived out here? And give me an example of how you have seen it lived out here in your work experience. So we keep it alive. We keep it alive, and we audit ourselves, and we really hold ourselves accountable to that.
So that would be one way in terms of the feedback that you're getting, that you'd also measure the impact, Susie, in terms of whether it's not just, what people can remember and recite, but whether they can show how it's enacted in terms of their workplace experience.
Yes, we love stories. We love to collect stories of our own team members living out our mission and our service standards. And so we do that throughout the year. We gather examples of how team members have seen other team members do this. And then we actually celebrate that once a year. Our celebration is coming up in early March. We're going to have our annual town hall where we celebrate our full care experience recipient winners, team members that got nominated by other team members for living out these 4 service standards. And each hospital has this town hall. In fact, Our largest hospital, AdventHealth Orlando, just had their town hall and celebrated their team members. And so where I work at the corporate services region, we'll be having this in early March. And it's just a really beautiful thing that we get to do at every facility across this organization to ensure those service standards stay alive and that we don't just recite them, but we live them, that we know what that looks like.
Susie, how have you found these standards and values both useful in decision making, because they obviously provide a bit of a North Star, but have you also found them difficult to live up to in decision making relative to HR practices or policies where you might had to look at them and look at them again before a decision was made to say, look, this is going to be tough, but if we're going to stay in alignment with these, we might have to make a decision that causes us to go in a direction that we might not have been initially thinking.
Absolutely. So, healthcare organizations have really been struggling since the pandemic. This is just public common knowledge that healthcare organizations have financially struggled, have had such a negative impact because of the pandemic, because companies have had to make really tough decisions. And I can tell you that at AdventHealth, while we were not exempt from the pain and the stressors that came from that, because our mission is so strong here, and because of the service standards that we truly do live out as we work towards that Vision 2030, we did have the forefront of our decision making. Here's just an example. When most healthcare companies were having to lay off team members during the pandemic, we really thought about how do we fulfill our mission of extending the healing ministry of Christ, not just to the folks coming into our hospitals, but also to our team members. What are our other options? What else can we do other than go to that first resort like many other healthcare companies were doing, of laying off team members because labor is where you have the most cost? And we made very tough choices and decisions to not do that, to protect our team members, to truly love them and extend that healing ministry to them and their families, because we wanted to try any other effort first before we touched our team members.
And were you able to do that, Susie, throughout the pandemic then? You realized no layoffs? Oh, good for you.
It was pretty phenomenal. And we have an amazing CFO and finance team and investment team, and God has blessed this organization. And I believe it's because of the way that we truly do live out our mission. And we have been able to come through that financially strong and having a workforce that continues to grow and knows that when times got really tough, we had their back. We had their back. Things were never perfect because no company is perfect, no human is perfect, but we had their back, and they really truly felt that.
There's another leg to this stool in terms of the triangle, and I think you refer to it as team member promises.
Yes.
Can you talk about that for a moment? Because I think that probably completes the structure that you were talking about before, Susie, if that's right.
So within the pyramid, I was mentioning that a part of the foundation as we build up those strategic aspirations are the team member promises. So when we started to develop consumer promises, what we promise to our communities and to the consumers that come into our doors, we also recognize that if we're going to make promises to the communities of how we're going to treat them and care for them, we also need to make promises to our team members. And so we began this beautiful journey of asking our team members, what matters most to you? What would help improve the team member experience from the moment you choose to work at AdventHealth till the time you choose to leave us, which we hope is very far away at your retirement. And so we asked them and got that feedback, and then prioritized based on their needs, and recognized that there were 6 very specific team member promises that we could start to work on and then build off over the years. And so we started that journey several years ago. And some of those, just to list a few, would be, for example, to make someone feel like family on day one. We want we want our team members to join this organization and feel like they belong from the first day they show up. And that might look like a leader sending that team member a text before they start with a picture of the team saying, "We can't wait to have you start, Mimi. We're so excited to have you join the team." It might mean like sending flowers to their house before they start to make them feel like, wow, they're really being thoughtful and thinking of me. It also looks like having all of their equipment ready and having a training program developed and ready so that when they start, they feel like, okay, someone's thinking about this. They're prepared for me. They're ready for me. And they're happy to have me here and they're welcoming me. And so that was one of the team member promises that we made. And along with each promise comes a variety of projects and initiatives and things we do across the entire enterprise to make sure we're fulfilling that promise. Because we made some bold promises. And it does take a lot of work to be able to fulfill those promises. Another example is to have a lighted career path. So I mentioned I've worked at the organization for 21 years. It is not uncommon to talk to people at AdventHealth that have worked here for 30 years, 40 years plus, that spend their entire career here. Because we are a large organization, we're in 9 states, and we have so many options for team members who want to move throughout those states and work at different facilities or come to our headquarters or go into a market. And so that lighted career path is intended to help somebody starting at the ground, knowing how to grow up. If they come in as a technician and they one day want to be a chief nursing officer, we have a lighted career path developed that can tell them, well, here's where you start and this is how you can get there. And so we're working on developing that for every section of our business. For example, if an HR professional started as a benefits analyst and they want to be a chief people officer one day, we have a lighted career path that can help them see how they can make that happen. And it's a tool we have to really retain our team members and just keep them engaged while they're here.
So, Susie, what role does HR play in the realization of these promises? Do you own the program? Do you partner with the business in a co-design, capacity? How does accountability work for that, and who makes sure that it cascades across the organization?
Sure. So the beautiful thing about our organization is that HR has a seat at the table. And our CEO and our chief financial officer, they both truly value the work of HR. They view us as a strategic partner. And so these team member promises are owned by HR, but we strongly collaborate in this organization. And we can't do anything successfully without it coming from the very top, right? We know that culture is set from the top. We know that an initiative for it to be successful has to be driven from the top. And we have had the full support of Terry and all of our leadership. And so while HR has owned it and will develop the programs and develop the tools and the communication to roll it out to all of our facilities, we do this in partnership with our C-suite, with the chief financial officers at each of our hospitals, the chief nursing officers. We can't leave them out because, they have the largest portion of our workforce, our clinicians, our nurses. And so we collaborate a lot with our chief nursing officers to ensure that everyone is aligned and that we all understand why we're doing this and that we all continue to work towards the promises that we made, that we said we would fulfill, and continue to refine. And that's what we do.
Susie, I want to move from the vision and the framework of the organization into HR's initiatives. But before I do that, just because you mentioned this in terms of people with long tenure, I was doing some research because as you and I spoke about, Terry Shaw, your CEO, has announced his retirement, and I think the summer of this year, right, July or so of this year. And the thing that I found amazing was that he himself is 40 years tenured in the organization, right? And moved up around the organization to a variety of different regional and headquarters roles and retires 40 years later. So you don't see that as often these days.
Right.
CEO retiring with virtually, I imagine his whole career now,
It's
having
amazing.
been here. Yeah, it's pretty amazing.
Yeah, he started in finance as an analyst and worked his way up and did great work. And he told us the story the other day. It was pretty amazing.
Oh, yeah.
And you don't see it a lot, but you do see it here. And again, I think that just goes back to the culture we've created, the mission that we have being so unique, and the folks that come here feel something different here, and they want to be a part of that. And they believe in the work we're doing and why we're doing it, because we always have people at the forefront. We have our patients at the forefront of everything we do. Sometimes we're the patient in our own hospitals, and it's just that reminder of why we're doing what we do. And as an HR professional, I love people. I love that the word people is even in my title. And I truly just love being a part of a company that values people to the point where they don't just value that you're someone that's coming here and doing a good job, but they actually care about my heart, my mind, my spirit. They care about all of that. And I see that lived out.
So then maybe we can use that to transition into HR and the people programs and initiatives that you run there. Can you give me a sense of some of the important, challenging initiatives that you're running in HR now, and perhaps ones that you might think are innovative or really unique to AdventHealth? So then give me a sense of HR's strategy in the context of the growth strategy and mission of the organization.
Sure. Well, we know that the more team members we have and we're continuing to grow, we are on a growth trajectory that continues to be as phenomenal as it's been the past 10 years. And so the more team members that we have, we know the more leaders we will meet. And so AdventHealth is really investing in ensuring that we have robust leadership development programs to support those leaders, especially those frontline leaders, the roles where you become a leader for the first time. Perhaps you are a really amazing bedside nurse, and now all of a sudden somebody is asking you to lead a team of nurses. Just because you're an amazing bedside nurse doesn't mean you automatically have the tools and the ability to transition to leading people. That is a very different skill set. And so we're working really hard to ensure that we have the right programs in place and the right culture in place that fosters that learning community around that nurse who is now becoming a nurse manager and needs to start learning, how do I manage people? This is a very different challenge than taking care of a patient. So we're putting together different programs like Leading for the First Time. That's the name of a new program we're launching. And it is intended for those first-time leaders who have never been a people leader before, to make sure that we are equipping them. Now that we have asked them to go do this, we have to give them the tools and the resources to do this and the knowledge and the support. So that's one example. Another one that I love is that instead of tying pay to performance, we focus our work around development and how can we develop our team members. The studies and the research has shown that, if I score you a 4 and give you a 3% increase because you got a 4 rating out of 5, that in itself is not what's going to make you a loyal employee. That is not what's going to keep you. What's going to keep you is if I know you and I take the time to connect with you and I continue to talk to you about, Mimi, what is it you want to do? What are your goals? What are your aspirations? How can I help you achieve them? How can we collaborate on this learning plan and this development plan for you so that you can really feel fulfilled in the work that you do here? And so we have weekly connections that we have all of our leaders do with their direct reports. And then we have development conversations twice a year that our leaders do with their direct reports, all around developing their team member and staying connected and making sure that that relationship is fostered and developed and we really know our team members. So those are some cool things that we're doing. And it takes it takes commitment. This is a large organization, but that just goes to show you how every program we develop, every initiative we have always goes back to the root. What is our mission? What are our values? What are our service standards? From that, who do we want to be, and what types of programs do we need to develop to get there and to really live out the things that we say we are?
Don't you think, Susie, that when mission and value plays such a strong glue idea through the organization, from values to behaviors to programs to action, that it's indicative of playing a long game. Right, Susie? Like, you've got to play a long game if you are going to put such a high premium on developing the leaders of tomorrow,
Absolutely.
developing a learning culture, which takes a long time to instantiate, and a lot of, pieces that have to come together for people to internalize that and make that part of their behavior set. So it seems to me that a lot of the things that you describe, are indicative of playing a long game in terms of the strategy.
Absolutely. And that is another element of this organization, that when we set a vision, it's not just constantly changing. It's not this, okay, now we're going to pivot 1 year later, and now another year later, we're going to pivot. And in organizations that tend to do that, you won't see the C-suite stay longer than usually 3 years. Typically, their C-suite is turning over 1 to 3 years because they're constantly just rolling out something new and shiny and pivoting, and it creates a lot of stress and burnout and just disorganization. We are very intentional about the work we do and how we do it, how we make decisions, how we roll out our programs, how we set our vision, how we stay aligned. Now, obviously, there are times when we may need to pivot because things happen. But when we set a vision, we are working towards it. And it's hard to believe that we're already, over halfway there.
So, Susie, how does the tremendous growth that you've experienced, 100,000 employees now, and I think the financial growth under Terry's tenure is almost double, right? Almost double revenue over the past 10 years. So, how does that kind of growth stress your kind of system? Like, where do you see that stress happen, and how does it either backwash into HR, or how does it, start in HR as you're trying to deliver your services to the organization? How does growth stress the system?
Sure. So growth is a beautiful thing. Growth is intended to be something that stretches us and pulls us and makes us uncomfortable. And by growing, we can blossom and evolve into something beautiful. But sometimes the journey of growth can be painful. So one way that can show up in the workforce is through burnout. And as we acquire facilities and as we stand up new facilities, that can be a stressful time for team members because we can often feel a sense of burnout as we are working towards, these new acquisitions to ensure that we can bring on all of these new team members that are joining the organization, that we can help them understand our culture, that we can get them assimilated, that we can get everything in place for them financially, with supply chain, with the clinical teams. And so I would say burnout is typically the most common thing that we see as we grow. And it's not something that anyone is really exempt from, but it's something that we have to be mindful of. And we have to ensure that when we talk about whole person care, when we talk about wholeness, that even though we might be working really hard and working really fast and doing a lot of great work, that we are still taking the time to rest. And we're still taking the time to pause and reflect. And we're taking the time to really take care of our body, our mind, and our spirit. And so we continue to remind team members of how we can do that. And we provide them with a lot of resources through Lyra Health. We have a partner with Lyra to provide not just the employee assistance program, but amazing coaching and mental health resources to all of our team members and their dependents for free. And this is just one tool that we make available so that if team members need that type of a resource to help them work through any type of stressor, whether work related or not, that tool is available to them and easy to use. And really just the emphasis of it's okay to rest. It's okay to rest, giving each other that permission. I even heard our CEO at an all C-suite meeting where we had our 470 executives from across the organization come together. In that 2.5-day agenda, he took the time to talk about pausing and taking care of yourself, making sure that you are taking care of yourself so you can take care of your team, so you can take care of your family, so we can take care of our communities. If we're not taking care of ourselves, we can't take care of anyone else. And that was so meaningful that when he could have been talking about anything else, he was choosing to talk to all 470 executives about making sure to take care of ourselves. And he had a few executives up there that gave us their experience with how they take care of themselves and what that journey may have looked like if at one point in their career they weren't good at it, but now they're committed to it, and what that looks like to help really inspire the rest of us to say, okay, I can do this. Maybe now I understand what that might look like and how I can incorporate more balance into my life or some exercise into my life or moments of reflection so that I can think about what went well, what could I do better, what am I proud of? Let's celebrate what went really well and learn where we can get better in the future. If we don't stop, pause, and reflect, then we're not being the best we can be. And so I would say that that's probably one of the main things.
I think that makes sense. I just want to remind people too that you've got a huge frontline workforce. So, right, Susie. So this concept of burnout by frontline healthcare workers, which, as you said, has been seen widely, since COVID across the organization, across those organizations, with a long tail to it, a long tail in terms of burnout, staffing shortages, et cetera. So this whole idea of serving our frontline people who serve directly others, it's got to be a big idea in terms of making sure that, they know that they've got the support services that they need.
Absolutely.
Yeah.
Absolutely. Because if we don't take care of our own, how are we going to ever take care of our patients? We would not exist without our people. And that is why we always say that our people are our greatest asset, because we can't do this without them. So it is something we continue to work on, Mimi. We're not perfect at this.
Yeah.
But it is something we are intentional about and truly want to master.
I imagine it goes back a bit to, as you were saying before, this idea of dealing with, the whole person as a strategy. And, I meant to point out at the time that you said it, since that goes back to your point to the inception of the business, that was a pretty unique perspective back in the 70s in terms of whole person care, right? Really. I mean, today it's obviously, much more commonplace, but back then that would be, I'm sure, a strategy and a vision that would have been less commonplace.
Absolutely. I really feel like the individuals that were passionate about healthcare when our organization started were health visionaries of understanding that the person is just more than a sick body. And we need to really look at the whole person. And I love that it started from the beginning, but that it's just been a part of who we've always been.
Yeah.
Absolutely. And now I do love that it is more widely recognized by, not just within the United States, but more widely across the globe, and that this is now something that has more attention.
Yeah, it's a top agenda of all the companies that we work with for sure. And I still think it's something that businesses are striving to, get out into the open, have it be a very direct conversation, not having stigma associated with it, et cetera, et cetera. I think it's still a work in progress, for all of us in general, society and business. So, Susie, your workforce is pretty diverse, and they're in difficult to reach locations, difficult hours that they work. Can you tell me what is HR's strategy for reaching people, communicating with them, engaging them, and what means have you found to be particularly useful and impactful based on your workforce? And are there things that you've tried that you would say didn't really move the needle as we had hoped?
Sure. So I'm going to answer that question two ways. The first way will be how I personally see this happening within the region that I support, which is our corporate services region. So keep in mind, these are all of our back end professional roles that support the system as a whole. And we exist to support our facilities that are, out in the markets that we have a presence in. So these might look like our finance teams, our customer service teams that are in call centers, our attorneys, our HR teams, our shared services teams, supply chain teams, and so forth, right? And we are around 6,700 corporate services team members. That includes our IT workforce, which is around 2,400 IT individuals. And they are spread across 46 states. So my workforce is not all right here on this campus with me under the roofs of the buildings here on campus. We have quite a few here, but we can't fit 6,700 team members here. And a lot of these functions are fully remote functions now. So we are constantly thinking about how do we stay connected and how do we engage? How do we keep that culture alive? How do we ensure that people feel included and feel seen when we can't physically be in a room with them? And so this is work that we have been really trying to become experts in, and we have made great strides. Our turnover for our corporate services region is less than 7%, which is phenomenal. And we have extremely high top decile engagement scores within our corporate services team. In fact, our engagement is extremely high across the entire organization. But specifically within this workforce where it's even more challenging, you talked about, different hours. Many of them are working different shifts too, because we have our revenue cycle team members included in that. And so what we do is ensure that our leaders understand what it means and what it takes to be intentional about staying more connected. We obviously use Teams and Zoom a lot. And so one of the norms we created around that is that we're cameras on. We're cameras on because we want to stay connected to you. If we can't see you in person, we miss seeing you. And so we want to stay connected to you. We want to be able to have that interaction versus just a voice. And really just helping leaders understand that you can still stay connected to someone. It might just look a little different. So instead of leaving them a little note on their desk, you might be sending them a text. Or instead of putting a gift card on their desk and saying thank you for going above and beyond with the project, you might be sending them a really cool Grubhub, delivery or something from Uber Eats as a thank you. And so just helping them kind of think differently and understand that you can still stay just as connected with your team. It just takes more intention when they're not all physically with you. And communication is super key. So because of the types of roles that we have, we are always on email. And so email for us is one of the ways that we find communication to be most successful. But that tool doesn't necessarily translate in the hospitals where you have nutritional services, you have transportation, environmental services that often don't have computers. And then the clinical staff, while they may have computers, they have very little time to be on the computer because they're taking care of patients.
Right.
And so in the hospital setting, they may lean more on team huddles, ensuring that leaders have the right messages and talking points for team huddles. Town halls may be more frequent in a hospital setting than they would be within a corporate office. But we really do equip our leaders with a lot of communication toolkits, FAQs and talking points. And then we have other methods of communication, whether it might be a news channel that some of our hospitals have, where it actually looks like a news channel, but it's done internally, by the marketing team. Or it may be a newsletter that's sent out, or info screens on the wall where we have different updates and communication. Sometimes, seldomly, I would say hard copy mailings to homes, but that's not something we do as often. There's something to be said about really having that face-to-face opportunity to connect and give updates and share information and explain the why and have that interaction and collaboration together. So it looks a little different depending on the setting, but there's a lot of intentionality around ensuring our leadership teams know first, and then we trickle information down to all levels of leadership and team members, no matter where they physically sit and no matter what the role is.
And in some of those environments, it sounds like, and it aligns a bit to what you were saying before in terms of leadership development, where you are so dependent on frontline leaders to be cascading messaging down to the team because they might be the only consistently reliable
Absolutely.
channel, right, that you have to reach some of these folks. So
Absolutely.
line of sight.
That person holds the key. Really, they're the one that gets the information from above and can make sure that information gets down below them. So ensuring that leaders understand how communication is so critical. It is like air that we breathe. If we're not communicating with each other, then we're not building trust. Then there's chaos. There's duplicate work happening, inconsistencies. We can't have that happening in a healthcare setting. So it's really important that we focus on that leadership development, clear communication, equipping them with the right tools, and that we're ensuring that gets down to all levels.
And I like some of the toolkits that you were talking about because, you want to make sure that the cascading of messaging cascades the right messages, right tone, right narrative, right stories, whatever it is in terms of, how you get the messages out with impact. Big idea. Yeah.
And we're very strategic about that. Within our corporate office, we support our facilities by building out a lot of those toolkits so that we can ensure that the right messaging is being consistent as it is released throughout our markets. And then a lot of times it may be released from an HR business partner in the market, a chief people officer within a region, or perhaps from the CEO directly. We have our engagement survey coming up in March, and that's an example of where we've developed a toolkit that our CEO has an email that they send out, and then our HR business partner has an email they send out. And in the cases where we're not relying just on emails, then we have FAQs, we have talking points, and those are embedded in team huddles and those daily meetings where they're circling up together. Here are all the key things you need to know. We're launching our survey. Here's how you can access it. QR codes all over the building so it's easy to click on, mobile friendly. These are ways that we're always thinking about how can we ensure the right message is consistently shared with everyone and that everyone has access to it.
So you really take this as a system idea, an integrated system. What is our integrated system of communications? How do we make sure it's multi-channel, if you will, and aligned? Cascading isn't just the idea of how we do it. We give a lot of tools to make sure that it gets done well, that kind of thing. It's a big emphasis in terms of, making sure that alignment through communications takes place. That's what it sounds like you're saying.
Yes, absolutely. Yeah. And one of the latest things we started doing, which I love, because now so many of us are using Microsoft Teams and the Teams chat all the time. Now we're starting to even get, as a part of that communication strategy, we're partnering with IT to say, how can we embed reminders in Teams? So now we will get a reminder about, hey, it's time to have your development conversation. Here are the team members that you need to have that conversation with. And by the way, this month, here's who is having a birthday and who is hitting a service award milestone for having service time with us. And so it's a nice way to use the technology, but also to think about, okay, what are new ways we can communicate with our leaders to make it easy for the leader so that they can then go communicate with their teams as well.
Right. No, that makes sense. That makes good sense. And is employee communications in HR, Susie, or is employee communications in corporate comms and you just manage a relationship between HR and communications? How's that structured?
I would say it's a partnership. If we are working on um, an HR communication, we do have somebody sitting at the corporate office that is over all HR comms, and they do sit within HR. But there is a close collaboration with our corporate communication team because we always want them to have line of sight of the different initiatives that we are rolling out and building communications for. But we believe communication is so key that we do have our own team of communication experts that sit within HR and work on all HR related communications that will be deployed throughout the whole organization.
And then they work subsequently with the business partners or otherwise to get
Yes.
those out into the
Yes.
organization.
We have a toolkit that it feels like we get a toolkit every week almost. And we always have something great we're promoting or
That's a big
talking.
effort. That's a big
It
comms
is.
effort. It really is. It's a lot to do with that level of rigor on a regular basis and have it work systemically, like we said. Yeah, big effort. Susie, I just want to bring us around the bend here in the few minutes that we have left. I wanted to talk with you about, strategies for change. I think some of them we've covered as a result of, the cultural and engagement strategies that you use. But I just wanted to point to ideas like, um, you know, building and engendering trust in the workplace and any other strategies around ensuring connectedness across the organization and developing relationships. And maybe even, Susie, their relationships that might be changing now as the business not only grows, but technology comes into the workplace in different ways, such that the people that I worked with before might need to have a different, perspective put on them relative to teammates that I might be collaborating with tomorrow. So if there's anything else that you wanted to add to these ideas of building trust or building connections, and maybe even if there's changes to any of those ideas, particularly in areas like, relationships and networks, how you might be thinking about that, anything that might resonate.
Absolutely. The topic of connection is just something that resonates deeply for me. And when I think about the most successful teams here, the most successful departments, the most successful initiatives we've had, it all comes down to, was there alignment? Was there clear alignment on what we are working towards? Was there clear communication? And so when I think about connection, I think about alignment. And, and communication has to pair with that. Because in order for us to maintain trust with people and build trust with people, we have to be clear. We have to be communicating clearly. And even if we can't share all information right away, there are times where we are working on an acquisition and we can't share that outside of one particular group, perhaps, or even outside of a couple departments. But when you can't share detail around something, I do believe that one of the best things to do is just share why. Just say why you can't. Or if it's something that you perhaps can't do, like if there's feedback on an engagement survey that we looked at that and we can't do it, well, tell the team why, explain the why. So taking the time to say, have I explained in a clear way why we are doing this or why we can't do this? Am I taking the time to do that? That is how you start to build trust. And the larger we get, we have to be more intentional about doing that because we're all moving so fast and we're getting so big. And there's so many different teams now and so many different people that may be working on the same project. We have to stay connected and stay aligned on what we're doing, why we're doing it. And think about just this being a team effort. When we're all right now, our organization is getting ready to go onto Workday. That could be a whole hour that you and I just talked about.
Right.
Because there are so many teams working so hard, including all of our HR teams in the markets, to ensure we are ready for that go live date in 2026. And that is a great example of where connection, alignment, and communication are so critical to ensure that we do this right. That
Right.
we're all saying the same thing, that if you hear something, that you ensure you understand what they intended to say, and that there is no room for misalignment. And when you do those things, you're building trust. People will trust you when they see that you're taking the time to be clear and stay aligned to the goal.
I like the analogy, Susie, that you used. That of course you want to be transparent whenever transparency is possible, but if it's not, the fallback of why we're doing generally what we're doing. To me, it's one of the most underutilized topics of communication, but it connects the dots for people in such huge ways. So I don't really need to explain to you all the instances of this if I can make sure that you understand the concept and the purpose of it. And it might repeat itself in different ways, but at least you get the dot to connect on what it is we're trying to do in a macro sense.
Absolutely. I think it's one of those basics that
Yeah,
we just forget to do.
I agree.
And sometimes people are either too busy, so they forget to do it, or this is what also happens. People are uncomfortable around having the conversation because they don't want to say the wrong thing. And so they just don't say anything at all.
Right.
And that doesn't work in the workplace, just like it doesn't work in our personal life. If you think about it, if you lose a loved one and somebody feels like, oh, I'm afraid to say anything to her, I don't want to make her get emotional, I don't want to bring up feelings for this person, so I'm just not going to say anything, then that usually leaves the person feeling very alone and very unseen, like, why isn't anybody checking on me? When in reality, people are thinking about you, they're just uncomfortable so that they're avoiding it. That doesn't work in personal relationships, because in reality, we just need to say something versus not saying anything at all. Just like in the workplace, we can't just avoid having the conversation simply because it may be an uncomfortable conversation, or we're just, well, they don't really need to know that. Why should I tell them that? Taking the time to share information that is relevant, that can be shared, or just share it. This is all I can share, and this is why. As soon as I'm allowed to share more, I will, because I want to keep you informed. Just doing that is going to build a huge amount of trust.
Susie, it's kind of funny. You know that we talk to people around the organization in various roles. And if we talk to the most technical people, or the people that are really driving disruptive change in terms of automation and AI and other emerging technologies that you could question where the human is in the future state, of those capabilities, even they'll say that the future is really all about changing relationships. It's really all about relationships. It's about relationships now. They'll probably change. They likely will change, and there'll be different actors, if you will, in our ecosystem. But at the end of the day, it's going to come down to how we develop and build and recast some of our human relationships going forward. And this seems to me to be quite an epicenter of your business today. And I wonder if that won't help you with some of the disruption that's likely ahead as we think about technology and augmenting humans with capabilities to deliver, our expert services in more modern ways, whether those connections will be the things that allow companies like yours to make those transitions perhaps a little more smoothly. Thoughts?
I certainly hope so. There's still a lot of question around how do we evolve in the future and utilize more AI and utilize more technology, and the concept of there's always going to need to be a human. There's always going to need to be a hybrid model. We cannot be fully replaced, and there's something about a human spirit that technology will never have. And so because I believe that because we believe in whole person care, we're going to care about that probably more than other people. And because of that, we're going to figure out how to do it right. That's what I believe. I don't know what that's going to look like quite yet, but at least I have the faith that we'll figure out how to get there because we care about that whole person care.
Yeah, I think that's important for sure. So, Susie, just last thoughts here. You mentioned a couple of ideas that I would almost call, critical success factors to HR's success going forward. Do you want to leave our audience with a couple of ideas from your perspective that, at least in your organization, are the real building blocks of HR's support and your success?
Absolutely. I would say one of the things that has helped HR be successful in this organization is having a seat at the table with our C-suite. Having a very close relationship with the CEO and having the respect and the support of the CEO along with the chief financial officer of the organization. And so by being aligned and having that trust with those players, we are able to make amazing things happen. And historically, HR wasn't viewed as a strategic partner, and historically, HR and finance didn't necessarily see eye to eye. You wouldn't view those two as best friends. But what I love is that we have such a great partnership building and growing between our chief people officers and our chief financial officers. And right now, especially as we're harmonizing HR to prepare for a successful Workday launch, we have had to work just so closely together, all focused on what is our mission, what is our vision, what are our service standards, what is our vision 2030, how do we get there? This isn't you against me. This is how do we make this happen? And so I would say the most critical thing for HR to be successful in any organization is to have that alignment and collaboration with your CFO and your CEO and have them truly view you as a strategic partner. But of course, you got to be able to demonstrate that, right? And talk their language and help them understand the why behind what you're asking them to do and how it connects to the business goals. And so really being a strategic HR business partner is how you build that relationship. I would say that's one of the most key. And love people. If you don't love your people, you're in the wrong field. You have to love your people if you're going to be in HR.
Well, I was going to say, to your point that it's so helpful when HR is an accelerator to the business model, right? Because I feel like that's what you're describing. How do we get in the boat and we create momentum that otherwise wouldn't have been there if we weren't one of the critical, rowers here. And then you said you could just love your people, which was better than what I was going to end with. So I will leave it at that. Susie, this was a delight. I hope that we can come back on the other side of some of the projects that you're talking about, and also just do a plug. We're thinking of doing some LDS live on location shoots. I know, and I just loved some of the frontline workforce ideas that you have there. So maybe we'll come back and talk to you about that too.
I would love to talk to you again. I would love that.
So great to see you as always. And thank you again for giving us your time and your valuable insights. It's so appreciated.
Yes. Thank you for the opportunity, Mimi. It's so great to see you. Okay. Bye-bye.
Thanks. Bye.